Here is a step-by-step explanation of the pathophysiology of amenorrhea, absence of periods, focusing on both primary and secondary amenorrhea based on the disruption of the hypothalamic-pituitary-ovarian-uterine HPOU. Axis 1. Normal menstrual cycle overview. Regulated by the hypothalamic-pituitary-ovarian-uterine axis, hypothalamus secretes GnRH, gonadotropin-releasing hormone. Pituitary gland releases FSH and LH in response to GnRH. Ovaries produce estrogen and progesterone, triggering ovulation and endometrial changes. Uterus responds to hormones by building up and shedding the endometrial lining, menstruation. Pathophysiology of amenorrhea, step by step. Step 1. Disruption of hypothalamus, central cause. Cause: stress, eating disorders, excessive exercise, tumors. Effect: GnRH secretion, FSH, and no stimulation of ovaries. Result: hypogonadotropic hypogonadism, anovulation, no menstruation. Step 2. Pituitary dysfunction. Cause: pituitary adenoma, e.g. prolactinoma, Sheehan syndrome, trauma. Effect: impaired secretion of FSH and LH despite normal GnRH. Ovarian stimulation, estrogen and progesterone, no ovulation or endometrial proliferation. Result: secondary amenorrhea. Step 3. Ovarian dysfunction, ovarian failure. Cause: polycystic ovary syndrome, PCOS, premature ovarian insufficiency, Turner syndrome. Effect: ovaries fail to respond to FSH-LH, estrogen production, or chronic anovulation. In PCOS, excess androgens inhibit ovulation. Result: no ovulation, no corpus luteum, no progesterone, endometrium remains unchallenged, no menstruation. Step 4. Uterine or outflow tract abnormalities. Cause: Asherman syndrome, intrauterine adhesions, congenital absence, malarianogenesis, cervical stenosis. Effect: endometrium is either damaged or absent. Ovulation and hormonal cycles may be normal, but no outlet for blood or no endometrium to shed. Result: cryptomenorrhea, hidden menses, or primary amenorrhea. Step 5. Endocrine or systemic disorders. Cause: thyroid disorders, hypothyroidism, adrenal disorders, CAH, Cushing's, hyperprolactinemia. Effect: these conditions affect GnRH or prolactin levels. Hyperprolactinemia inhibits GnRH, LH, FSH, no ovulation. Hypothyroidism, TRH, prolactin, same pathway. Summary table: causes by level. Level cause examples: effect: hyperprolactin, no ovulation. Hypothalamus: stress, weight loss, exercise. GnRH, FSH-LH, pituitary tumors, Sheehan's, FSH-LH, ovaries, PCOS, Turner syndrome, chemo, no ovulation, hormonal imbalance. Uterus outflow, Asherman's, congenital anomalies, no endometrial shedding. Other endocrine hypothyroidism, prolactin, CKH, inhibits HPOU axis. Final common pathway. Regardless of the origin, amenorrhea occurs due to failure of one or more of the following: ovulation, endometrial response, anatomical patency. This prevents normal menstruation from occurring. Thank you. Have a nice day.